Hey guys, it's Whitney, your family practice PA here, and today's video I'm going to be talking about a thought process or a lifestyle that I have been talking to a ton of my patients about. The more research I do in this lifestyle slash kind of diet it just keeps showing more and more benefits, and just really wanted to bring it to you guys, to go a little more in depth about what it means, kind of what the focuses are, but a lot about what are the actual benefits of the Mediterranean diet. So it's really looking at, we found that this region in Southern Europe just seemed to be a lot more, especially cardiovascular, there's just less instances of it, less cases of it. And really the medical researchers wanted to dive into it and see what it was all about. Why were this region of people seeming to have a lot less chronic diseases that we have all other parts of the world? And so today's video, we're gonna dive more deeper into that. So without further ado, let's get into it. So with what makes it more special, the one thing that I really wanted to start with is that it is more of an eating style. It's not a strict diet. So a lot of times we go on these fad diets. You know, there's been tons throughout, just some of them are the paleo diet or keto diet or Atkins diet, and people can have success with those. There are some negatives, and I might do some further videos on kind of what all those diets are about and why a lot of people do fail at them. But there are cases that people do incredible, so everybody needs to find what's right for them. But the nice thing about the Mediterranean diet is it really is not a diet. It is a lifestyle. We have more groups of foods that we focus on, but no food group is completely eliminated, which makes it a lot easier to stick to. And so that's where I said it's not a set of rules. It's more just general ideas, and we're gonna go into that further, but it's how we wanna focus our plate to look like when we're getting our different foods. So it focuses on whole, less processed foods. So especially in that region of the world, they're getting fresh fish, they're getting their fresh protein, they're getting their fresh veggies, their fresh fruit. And so especially for us in the United States, we've gotten used to a lot of our foods being packaged and processed for us. And so a lot of times they're having more preservatives, things like that, which can make it easy on us. But we go and we make a week to 2 week grocery list. That doesn't always set us up for success when we're looking at preventing chronic diseases, because most of that food to last that long have to have a good bit of preservatives in there. So when we're going to get our frozen meals, different things. And I'm not saying there's not there's not good things about those foods, and sometimes we need that convenience. So definitely want to plan ahead. It's just trying to implement more of these less processed foods into our diet. It doesn't have to be 100%. I tell a lot of my patients, and if you've seen my previous videos, I really am trying to focus on, I'm doing these principles in my life, I can always be healthier. So is the 80-20 rule. 80% of the time we're really trying to be good, trying to focus on the different aspects of each individual diet. You know, I'm trying to eat less processed foods, or I'm trying to eat less starches, different things like that. 80% of the time I'm doing really, really good. 20% of the time it's gonna be some mess ups in there. And they don't even have to be considered, I don't like using the word failures. It's counting more, focusing on the victories, and each day, each week, trying to get a little bit better. When we do that, it's not a sprint, it's a marathon. So that's gonna be the main focus, is trying to get more of those whole foods built into our diet. It is a focus on types of food, guys. It's not on calorie counting. So that's where it's coming back to, there's not a set of rules. It's a general idea of the food. So like I said, later in the video, I'm gonna break down like what we are focusing on, but just trying to get an idea of what makes this lifestyle special. What benefits can we expect from it? One of the huge rules of the Mediterranean diet is the more the colors, the better. So we're going for those fresh veggies, those purples, those greens, those reds, those oranges, those yellows. We're talking about peppers and tomatoes and cucumbers and all the different types of lettuce, the dark green, trying for those bright, vibrant colors usually means they're more fresh, and we're getting a wide variety of nutrients coming in, getting really, really good antioxidants, which is going to show later on about how to prevent this chronic disease, which is what my whole focus in family medicine has started to become. I've seen the horrible effects of it, and I'm so thankful for the medications that can help treat these patients, but the more people we can get, or at least not have those chronic diseases, or at least prolong it till later in life, is huge. It breaks my heart how many of my patients are getting diabetes, hypertension, high cholesterol. The hypertension is high blood pressure at such a young age. So that's become my passion, and I want to bring that to you guys too. So the more colors, the better. Okay, so to get more in depth into this, so why should we do this? What is the benefit of the Mediterranean lifestyle? Why would you want to put effort into learning more about it? So about 18 studies, a review of 18 studies they looked at and found it to be the best heart healthy diet. So we're going huge for cardiovascular, because if we do cardiovascular heart, that's what helps us protect us from heart disease, heart attack, heart failure, which breaks down into that high cholesterol, everything that can lead to those worsening cardiovascular disease. Help us prevent us from stroke, help us prevent from cancer, and help us prevent from dementia, all of these things. So the New England Journal of Medicine found that it decreased the risk of cardiovascular disease by 30%. That is a huge difference. So that alone really should make you go, maybe we should look into this. So to decrease it by 30% just by adding more colors to your plate and following a few simple kind of lifestyle rules or guidelines, I think it's worth looking into, guys. So it decreases the risk of cardiovascular disease, stroke, diabetes, and dementia. And it does this by being low in inflammation causing foods. So I've done a video that you can check out on an anti-inflammatory diet. But if we help decrease inflammation in our vessels, help decrease inflammation in our body, it helps us with arthritis, it helps all of the blood flow to be better, helps these blood vessels, it increases blood vessel function. So we're not getting that plaque buildup in our heart or different vessels that can lead to stroke. We're not getting that plaque built up, okay? So that's where it kind of comes on those general rules. And so further looking into some of the research that's being done is in the Frontiers in Nutrition, which is a study that they did in a journal. It was a 2016 review, found that it helped us produce less cognitive decline. So that means our brain's functioning, firing better. We're not getting that short-term memory loss, that long-term memory loss, those early onsets of dementia, different things. Now, there are still causes for this that can happen that are out of our control, but what we're trying to do is focus on what we can control and lower our risk of this happening, okay? So with that came a decreased risk of Alzheimer's disease, which is a huge concern of a lot of my patients. Nobody wants to live their whole life, work so hard, they get into retirement, and then they start developing dementia. They can't remember the people around them. It leads to an earlier death. It's just a really sad disease process. My grandfather died of this disease. I actually did my master's project on trying to help prevent or prolong the onset of dementia. And this was one of the huge things, was the Mediterranean. So for literally the past 10 years, been trying to preach more of this, but there's been more and more research since I even came out of school. Like I said, this was in 2016. I graduated in PA school back in 2014. So a lot of stuff's happened even before I did my master's project. The journal Neurology found that eating a Mediterranean lifestyle type diet reduced the brain's age by 5 years. So who wouldn't want to have 5 more healthy years of their brain functioning the same way it is today as it is when they're 75 years old? Instead of it being at 75, we're at 80, or instead of being at 85, we're at 80. You know, it's giving us those 5 years with grandchildren, having all these different things, and even prolonging the progression of it. So even if we were to have it, it's going to help us. It's keeping all the neurons in the brain firing. It's helping prevent that inflammation so that things can just click a little bit quicker. That's all it is with dementia. When we're talking about Alzheimer's and other types, there's other types that are completely different segment, and we can, if you have any questions, I can talk to you further about that. There's a whole nother set, but this is our preventable chronic diseases, and there's a ton of that the everyday person normally functions with. That's our cancers, everything. It's coming from inflammation in our blood vessels, it's coming from inflammation in our cells, the when we're talking about depression too, it's antioxidants, trying to get toxins, preservatives, things that we know are affecting our mental health, trying to get that healthy diet, trying to feel better, helping prevent chronic pain, which can lead to depression because we're having all this inflammation in our joints and our muscles. So that's where that lower anti-inflammatory diet that comes with the Mediterranean diet is a huge focus. So what kind of foods do you need to focus on? The main actor is our vegetables. So it's our fresh veggies, guys. So that's where those colors come into. It's the fresh veggies, and then coming back down to our fresh fruit as well. One big thing that we have changed in America is that the supporting cast actually needs to be our meat. So I think in America, a lot of times we have a huge portion of protein and then we add the supplemental sides, but this needs to be the supporting cast. It doesn't mean that you don't need meat, but it needs to be that lean protein. Really want to focus on fish and seafood. Those oily type fish like salmon or mackerel are huge antioxidant. It's those omega-3s. It's those unsaturated fats that I've talked about in my videos that you can check out on my channel, on cholesterol, on blood pressure, or preventing high blood pressure, getting all those vessels working properly. So that's where those omega-3s, those healthy fats, olive oil, and fresh, high fiber fruits, nuts, all of those things need to be the bigger part of our diet. We can add more beans and lentils to our diet so that we're getting these other kind of meatless sources of protein. Those need to be a huge focus for us, is trying to limit a lot of the meats, because unfortunately it's not everybody and it's not everything, but a lot of our meats that we're getting have been heavily processed and preserved if we're getting them not from a fresh source. Okay, so we need to focus more on fresh protein, lean protein, all of those things coming into play. The dairy needs to be more things like Greek yogurt, lower fat cheeses, things like that. So that's why I'm saying less cheese. People don't realize how much of their high cholesterol, that LDL, the bad cholesterol, is coming from dairies. It's the whole milks, the cheeses, different things, because we're not getting them from the fresh sources like we did 50 years ago or in other parts of the world where they're getting it. So a lot of this is in our it's that easy access. We want the milk that lasts, forever, and not have to keep going to buy more and more, or if our kids don't eat as much cereal or we don't use as much milk, all those things really need to be, we want to go as fresh and less processed as possible so that we're not getting the chemicals in our body. So we're really focusing on whole grains, not the white breads, not those simple carbs that we've talked about in my diabetes videos, my Manjaro videos, my Ozempic videos, all those different things of diets that are big. This would be an amazing diet also for my type 2 diabetes patients, really anybody, but those are a huge focus of trying to get those veggies, less starches, trying to get, if they are starches, the whole grains, the higher fiber foods. So if you guys got anything out of it, please hit that like button, follow along on the channel, hit the subscribe button, guys. Doing videos like this all the time. Really leave comments for me. Let me hear what you guys want to have more information about. Right now, I'm just trying to pick out things that I really get a lot of questions from my patients here at my family practice in the Orlando suburbs, things that I think can help us a lot, and know that I'm putting these practices into my life too, that I can definitely be healthier, and really trying to focus on preventing these chronic diseases so that we can live healthy, happy lives. So again, thanks for following along, and I can't wait to see you on the next video.